Houston Methodist is the first vascular robotic surgery program in the United States. We started the endeavor with Alan Lumsden and myself in 2022. There are a few groups of surgeons in the country who have tried to do this in collaboration with other specialists like urologists and thoracic surgeons. Houston Methodist is the only one that has an official program in place. I'm Charu Bavare. I'm a vascular surgeon at the Methodist DeBakey Heart Vascular Center at Houston Methodist Hospital. I'm also director of the Vascular Robotics Program at Methodist DeBakey Heart Vascular Center. When it comes to innovation, Houston Methodist has been at the forefront ever since the 1950s when Dr. DeBakey got the polyester graft, made a cylinder on his wife's sewing machine and then sewed it in a patient. That transformed open aortic surgery for generations to come, and we still have it today. The second innovation that came in was endovascular surgery as a specialty for vascular surgery. And Houston Methodist has been at the forefront with dedicated hybrid rooms and in the operating room as well. The third big step for vascular surgery, I think, is robotics, where we would give the patients the same benefit of what Dr. DeBakey started, but with a minimally invasive approach that is so common now.
Massive shift has occurred in surgery in general and towards robotics. So for example, some residents are not getting trained in laparoscopic surgery, it's going straight to the robot. My name is Dr. Alan Lumsden. I'm the chair of the Department of Cardiovascular Surgery and the medical director for the Methodist DeBakey Heart Vascular Center. There is no question that the durability of the sewn-in piece of Dacron exceeds that of the catheter-based endovascular repair. But the delivery system, to do that means we got to open your abdomen from top to bottom. You're in the ICU for a couple of days, you're in the hospital for a week, and really it'll take you 2 months to get back to normal. Now, once you get there, you're better off because the endovascular, the more minimally invasive procedures, need many, many more revisions and a lot more intensive follow-up. But the concept is that the core therapeutic part of the operation is not nearly as good as the open operation. So we really want to avoid that, quite honestly.
We have initial data from our experience of about 95 cases as of today that the length of stay is substantially lower than open abdominal operations. Pain control with narcotics use is substantially lower, and I think that is enough evidence to say that robotics is here to stay. The volume of procedures that can be done by robotics is actually much smaller in vascular surgery. Hence, there was always a resistance to acceptance. But now it's been proven with a few surgeons in Europe and then our program in the US. Robotic vascular surgery gives the same advantage of a durable repair, but at the same time giving it through a minimal invasive approach, which is much more patient-friendly and better for patient recovery.
So Dr. Bavare heads up a robotic program, and he's done a tremendous job in doing that. He has influenced his partners. They're all kind of looking at it going, oh, I probably need to learn how to do that.
The interest is mind-blowing because every meeting I go to, Dr. Lumsden and myself are always asked about the vascular robotics program at Houston Methodist, not just about what we are doing, but how can we help train other surgeons to do it. Since we've started in 2022, the robotics vascular program at Houston Methodist has really taken off well.
I think we've done it exactly the right way in terms of ramping up the complexity of the cases. We started off very simple. It's not like other surgeons have not looked at this, but what's happened is it's got a bad reputation because I think the mistake was they leapt to the big complex cases first of all. We're very fortunate here in having Mighty, which is probably the preeminent place where you can go practice this stuff.
Houston Methodist has Walter Tower operating rooms where every room has a capability of streaming real time, not just in Houston, but to any corner of the world, where any surgeon who wants to learn from us would have the ability to log in and get to see the vascular procedure done in a robotics vascular way.
I think that the spirit of innovation here is very much alive and well, and there's lots of examples of that.
The undercurrent of always trying to lead medicine, I think is the backbone of the success for the robotics vascular program. We are very proud to say that this innovation will be the next frontier of vascular surgery. Robotics vascular surgery is here to stay, and Houston Methodist will be at the forefront of this innovation.